The emergency carts contain many items that may be useful during a medical emergency. The emergency carts are red and have wheels that enable easy mobility. The contents of these carts are monitored weekly by the clinic supervisor. There are 2 carts that are stocked identically. They are stored in the centrally located east hallway of the clinic at the end of A bay and C bay. A pulse oximeter, a glucose monitor, and reference charts are located at the top of the cart, along with a fully stocked basic first aid kit. The first aid kit contains things such as alcohol prep pads, antacids, acetaminophen, antiseptic wipes, Band-Aids, gauze, tape, scissors, and tweezers, various topical first aid ointments, and a cold compress. In the first drawer of the emergency cart, you will find a medical emergency reference manual and a small emergency kit which includes scissors and razors. Emergency drugs are located in the second drawer. The emergency drugs available in our emergency carts are as follows: aromatic ammonia, which is a chemical irritant that is used in syncope and fainting; epinephrine, the red Auvi-Q epinephrine pen for adults and the blue Auvi-Q epinephrine pen junior for children weighing 33 to 66 pounds, is a cardiac stimulant and bronchodilator used to treat acute allergic reactions or anaphylaxis and acute asthma. Auvi-Q should only be injected into your outer thigh through clothing if necessary. We offer trainer cartridges for practice, which we encourage you to utilize.
This trainer contains no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency. If you are ready to use, pull red safety guard down and off of this trainer. Place black end against outer thigh, then push firmly until you hear a click and hiss sound, and hold in place for 2 seconds. 2, 1. Training complete.
Nitroglycerin sublingual tablets relax blood vessels for easier blood flow to the heart and are used to stop chest pain. Injectable adrenaline is a cardiac stimulant and bronchodilator used to treat anaphylaxis and acute asthma. Inhaled albuterol dilates the bronchi and is used to treat bronchospasms and asthma. The second drawer in the emergency cart also contains an ease vent to assist in the administration of the inhaler. Injectable diphenhydramine HCl decreases the allergic response and helps with life-threatening allergic reactions. Oral diphenhydramine is an antihistamine that helps with allergic reactions. Aspirin is used to reduce blood clotting and can help with chest pain or discomfort. Instaglucose elevates the blood sugar and is used to help with hypoglycemia. Narcan nasal spray reverses opioid overdose and is used to treat a known or suspected opioid overdose emergency. The third drawer of the emergency cart contains an extra ease vent for use with the inhaler, extra instant cold compresses, and an extra nasal cannula and mask for use with the oxygen tank, and a standard size blood pressure cuff and stethoscope. In the lower compartment, there are adult, infant, and child ambu bags, additional oxygen masks, and a fire blanket. An automatic external defibrillator is located in the east hallway of the clinic and is hanging on the wall on B bay between the emergency carts. It is easily visible and quickly retrievable. Fire extinguishers and fire blankets are available in the hallway near the emergency carts. One is also in the lab on the south wall, clearly marked, visible, and centrally located. There are 3 eye wash stations also available. 2 in the lab, and 1 in the sterilization area. All are marked. The eye wash stations function by merging a low-flow water source with a handle, which, when squeezed, triggers the water flow necessary for rinsing the eyes during emergencies. There is a spill kit hanging on the wall located in the east hallway of the clinic next to the lead desk, and also in the lab hanging by the north exit door. Medical emergency report forms are located in each treatment bay of the clinic and in the dental laboratory and are attached to a clipboard along with a stopwatch. These forms are to be used during an emergency for recording the vital signs, drugs that are administered, and the times that events occur. An oxygen cylinder with a flow regulator and a disposable mask attached is fixed to the side of each of the emergency carts. The clinic supervisor checks the oxygen levels weekly and orders replacements as needed. Oxygen resuscitation equipment is as follows. The oxygen tank. The oxygen tank is always green in color, and the E-cylinder is the minimum size recommended. Smaller tanks will not provide an adequate oxygen supply for a real emergency, and larger tanks are not portable. A flow meter, which controls the rate or how fast the oxygen comes out of the tank. The pressure valve, which shows how much oxygen is left in the tank. Tubing, oxygen mask, and a positive pressure bag, also called an AMBU bag. Attach the oxygen delivery system to the tank. Turn the key on top of the tank in a counterclockwise direction to open the flow of oxygen. Read the low flow regulator knob. To increase the oxygen flow, turn the knob in the direction the arrow indicates. Many regulators are opposite of sink faucets and open clockwise instead of counterclockwise. Attach the oxygen delivery system to the patient. Remove the oxygen delivery system from the patient and turn the key on top of the tank in clockwise direction to shut off the flow of oxygen. Turn the low flow regulator knob to open position to bleed the oxygen from the system. After bleeding, gently close the low flow regulator knob. Remember, there are contraindications to oxygen administration. A high concentration of oxygen is contraindicated for chronic obstructive lung diseases due to the risk of hyperoxygenation. An example of this is emphysema. Oxygen is also not indicated in the presence of hyperventilation.